Hey there, this is Dr. Evanoso with Fitness Education Seminars. Welcome to part 3 of Fascia and Fitness. If you missed the first 2 editions, check that out before continuing with this edition. And what have we learned so far about fascia? Well, we learned that fascia is everywhere. It connects all our tissues in our body and is integral in connecting the different systems of the body. We also learned that fascia contracts. It contracts both itself and it helps contract against the force of the muscle within the fascial envelope to help direct both posture and movement, as well as being proprioceptive. There's important nerve receptors within fascia that help send signals back to the central nervous system about where the body is in space, which helps then direct the response by the central nervous system about stabilization, movement, and integration. We also learned that trauma and inflammation affect fascia. Both surgeries, repetitive traumas, acute injuries, dietary influences on inflammation can all affect fascia, decreasing its ability to slide, decreasing the fluidity of fascia, and often will pull in the direction of fascial restrictions, whether it be from scar tissue and or inflammation. So a lot of our approaches need to also take that into consideration to decrease both inflammation as well as create more optimal alignment of the fascial tissue. And that's where soft tissue comes in, and that's where also proper alignment comes in to help improve fascial function. So, what can we do to help our clients improve and treat their fascia right? There's 3 major rules. Number 1 is hydration. Most nutritional experts recommend about 0.5 to 0.6 ounces of fluid per pound of body weight per day. So for your client that weighs 180 pounds, if you multiply their body weight by 0.6, that comes out to be 108 ounces of water per day. And most of our clients get way less than that. And if you've seen some of those videos on fascia that are on the web and or in the Fascial Stroll Underneath the Skin CD, what you'll see is fascia is contains a lot of fluid. It's highly fluid rich. So if we have a situation where we're just even slightly dehydrated, you can see how that will create inflammatory conditions and decrease the amount of sliding and fluidity within the fascial tissue. So make sure your clients consume enough fluid and fluid-rich foods such as fruits and vegetables. Number 2, fascial mobilization. So again, we need to encourage our clients to get soft tissue work, whether you do it yourself, which is fantastic, or you do soft tissue work through balls, bands, foam rollers, things like that to help mobilize fascial tissue. We need to be able to help the client align their fascial tissue better and improve circulation around the fascia. Again, fascial work is also important for physiological quieting, which calms down the nervous system, up trains the parasympathetic nervous system, down plays the sympathetic nervous system. It mobilizes fascia so the fascial lines and chains line up better, and it also helps improve joint centration. So again, if you use foam rollers, balls, things like that to help improve fascial mobility, then use that. And if you don't do soft tissue techniques, then encourage your clients to get soft tissue work. Let's look at fascial function in a common postural distortion that we see in this client here with a forward head and forward shoulder. You can see how the anterior fascia gets pulled up towards the neck and the head gets pulled down towards the rib cage. So you can see the arrow facing up from the rib cage, so the accessory muscles of respiration kick into play to pull the rib cage up, pull the neck down and forward. The shoulder rotators pull the shoulders forward and in, and we have shortening between the back of the neck, in the front of the neck, as well as through the chest and anterior shoulder region. Now if you see the pink arrows, that's the direction that we need the fascia to go. We need the fascia to be able to pull down the lower aspect of the rib cage through the abdominal wall, and the fascial lines through the posterior chain to elongate the neck and elongate the thoracic spine. So we basically want the head to go up and the rib cage to come down. So how can we do that? Well, 1, we can do a fascial stretch along with breathing. So as I'm breathing out, I think about bringing the rib cage down. You see the downward facing arrow. I'm bringing the rib cage down and then opening up the anterior chest. So I'm separating those 2 components. So if you look back here at this picture here, you see how those blue arrows are coming towards each other. And now as I do my fascial stretch, I'm mobilizing and opening up the anterior fascial line and the anterior oblique chain, but using breathing and core activation, not just merely stretching and hanging off the ligaments. I don't want to reach so far forward where the joint is decentrated through the shoulder and or the head or spine. So I want to elongate the neck and the upper spine as I'm elongating the anterior fascial lines. And I use my breath and core activation to help maintain proper alignment through my rib cage and torso. Next, I'm going to go into breathing. So my client here, I'm going to take her into breathing, where again, I focus on, you see the pink arrows where the one facing down towards her feet. She's activating her core to keep that rib cage in a caudal or inferior position as she elongates and thinks about elongating through her spine and her head. So again, I want to come down through the anterior rib cage and get long through her spine, which starts to encourage proper posture, and I encourage her to activate her core and breathe through this, again, which mobilizes the viscera, the internal organs. It mobilizes the abdominal fascia, it mobilizes the posterior chain fascia to allow her to get long and put her body in a much better alignment. So we know that it massages, as we said, but it also helps her quiet the nervous system and allows us to put new information in. And also, this is how we start to train trunk and core stabilization, basically thoraco-pelvic stabilization, the thorax over top the pelvis. As you can see, if you turn this client upright from this position, you see she'd be in really excellent postural alignment. Her head is aligned over her shoulders, which are aligned over her pelvis. A lot of our clients will have a hard time achieving this position, but this is a goal, and this is a direction we need to start to move our clients. Even though they may not get 100% there, we can get them closer and more ideal based on their own presentation. Once we've integrated and aligned them, taught them how to breathe and activate their core right, now we teach them how to integrate that into their fundamental movements by teaching them how to use and train through the chains. So again, we're going to respect the fascial chains. We're going to stabilize one chain. As you can see through the pink arrow, the client is stabilizing through the one diagonal anterior oblique chain, and then he pushes and rotates the trunk and the hip through the opposing anterior oblique chain. So that's signified by the blue arrow. So one chain stabilizes, one chain mobilizes. So we get this continual reciprocal action between these chains throughout the body. One's moving, one's stabilizing. One's moving, one's stabilizing. That's what helps create functional and foundational movement without overloading any significant area, any one area of the body. So again, if you treat your fascia right, it's going to treat you right back in return. So conclusion. Number one, we want to align our fascia to the best of the ability. We'll do that through both postural re-education, breathing, and fascial release, whether you do it through foam rollers, balls, soft tissue manipulation, manual therapy, and or a combination of all those approaches. Then we're going to teach them how to breathe. So we teach them how to maintain mobility of the viscera, the organs, as well as mobility through the fascial lines that cross the trunk and spine. Third, we're going to teach them how to coordinate these things, both their alignment, their breathing, their core coordination, into proper and fundamental movement patterns. And this is basically how we set up the integrated movement system, and what we do through the integrated movement system is exactly these three things: align, breathe, coordinate. I hope you enjoyed these three videos. I hope they were helpful. I hope they gave you a little bit of insight on how the fascial chains work and how important they are into improving function and stabilization in your client. If you found them useful, feel free to pass them on to your friends. Thanks for your attention. I'll catch you next time here at Fitness Insider. This is Dr. Evan Osar. Have a great day.